BSc Nursing Pharmacology Important Questions 2025 Malayalam. Question 1. Vernon is 60 years old. He has heart failure with reduced ejection fraction and takes Carvedilol 25 mg twice daily. He presents with dizziness when standing. His lying blood pressure is 130/80. His standing blood pressure is 82/45. His heart rate is 66. What is the most likely cause? Option A. Carvedilol caused orthostatic hypotension. Option B. Vernon is dehydrated. Option C. Vernon has autonomic dysfunction. Option D. Vernon has adrenal insufficiency. The correct answer is option A. Carvedilol caused orthostatic hypotension. Carvedilol is a non-selective beta blocker with alpha blocking activity. The alpha blockade causes vasodilation and orthostatic hypotension. This is a known side effect. Vernon may need a lower dose or a switch to metoprolol, which has no alpha blocking effects. The nurse who checks lying and standing blood pressure identifies the problem. Vernon does not need 4 fluids. He needs a medication adjustment. Question 2. Wendy is 44 years old. She has no medical problems. She presents with palpitations. Her EKG shows supraventricular tachycardia at 215 beats per minute. She is hemodynamically stable. The provider orders adenosine 6 mg for push. The nurse pushes the adenosine over 10 seconds and does not flush. The patient's rhythm does not change. What is the most likely reason for treatment failure? Option A. The patient has atrial fibrillation. Option B. The patient needs a higher starting dose. Option C. The nurse pushed the adenosine too slowly without a flush. Option D. The patient has Wolff-Parkinson-White syndrome. The correct answer is option C. The nurse pushed the adenosine too slowly without a flush. Adenosine has a half-life of less than 10 seconds. It must be given as a rapid 4 push over 1 to 2 seconds followed immediately by a rapid saline flush. Pushing over 10 seconds without a flush allows the drug to be metabolized before it reaches the heart. The most common cause of adenosine failure is improper administration. The nurse should repeat the dose at 12 mg with rapid push and flush. Question 3. Xavier is 55 years old. He has hypertension and takes lisinopril 10 mg daily. He also takes spironolactone 25 mg daily for heart failure. He presents with weakness and nausea. His potassium is 6.3. His EKG shows peak T waves. What is the priority intervention? Option A. Stop lisinopril only. Option B. Stop spironolactone only. Option C. Give 4 calcium gluconate immediately. Option D. Give 4 insulin and dextrose. The correct answer is option C. Give 4 calcium gluconate immediately. Xavier has severe hyperkalemia with cardiac toxicity. Peak T waves indicate the heart is at risk. For calcium gluconate stabilizes the myocardium immediately. Both lisinopril and spironolactone must be stopped. The nurse who delays calcium to stop medications or give insulin first puts Xavier at risk. Calcium first, then insulin and dextrose, then stop the offending agents. Question 4. Yolanda is 62 years old. She has hypertension and takes amlodipine 10 mg daily. She presents with severe constipation that has not responded to laxatives. An abdominal X-ray shows stool throughout the colon with no obstruction. What is the most likely cause? Option A. Amlodipine does not cause constipation. Option B. Amlodipine causes constipation but it is rare. Option C. Amlodipine causes less constipation than verapamil, but it still occurs. Option D. Yolanda has colon cancer. The correct answer is option C. Amlodipine causes less constipation than verapamil, but it still occurs. Amlodipine is a dihydropyridine calcium channel blocker. It causes less constipation than verapamil or diltiazem because it is more vascular selective. But constipation still occurs in some patients. Yolanda's severe constipation may be from amlodipine. Switching to a different drug class like lisinopril or losartan may resolve her symptoms. The nurse who dismisses amlodipine as a cause misses the diagnosis. Question 5. Zachary is 70 years old. He has atrial fibrillation and takes warfarin. His INR is 2.6. He starts taking Bactrim or trimethoprim sulfamethoxazole for a urinary tract infection. 5 days later, he presents with hematuria and easy bruising. His INR is 8.5. What caused Zachary's INR to rise so dramatically? Option A. Bactrim caused liver failure. Option B. Bactrim killed gut bacteria that produce vitamin K. Option C. Bactrim inhibited warfarin metabolism by competing for CYP2C9. Option D. Bactrim increased warfarin absorption. The correct answer is option C. Bactrim inhibited warfarin metabolism by competing for CYP2C9. Trimethoprim sulfamethoxazole is a potent inhibitor of CYP2C9, the enzyme that metabolizes warfarin. This interaction is severe and can cause life-threatening bleeding. Zachary's INR of 8.5 with hematuria requires holding warfarin and giving vitamin K. The nurse who fails to anticipate this interaction causes a bleed. Bactrim should be avoided in patients on warfarin whenever possible. Question 6. Ava is 49 years old. She has no medical problems. She presents for a routine physical. Her blood pressure is 152/94 on 3 separate visits. Her BMI is 32. She drinks 3 glasses of wine daily. She smokes half a pack daily. She eats fast food frequently. What is the most appropriate first step? Option A. Start lisinopril 10 mg daily. Option B. Recommend lifestyle modifications for 3 to 6 months. Option C. Start hydrochlorothiazide 25 mg daily. Option D. Start amlodipine 5 mg daily. The correct answer is option B. Recommend lifestyle modifications for 3 to 6 months. Ava has stage 1 hypertension with multiple modifiable risk factors. The guidelines recommend lifestyle modifications as first-line treatment. Weight loss, reduced alcohol, smoking cessation, reduced sodium, and increased exercise can lower blood pressure significantly. Ava may avoid lifelong medication if she makes changes now. The nurse who starts medication without lifestyle counseling misses an opportunity. Question 7. Blake is 66 years old. He has heart failure with reduced ejection fraction and takes metoprolol succinate 200 mg daily. He is admitted for observation after a fall. His heart rate is 50. His blood pressure is 108/62. He is asymptomatic. The night nurse holds his metoprolol. The morning nurse finds Blake with a heart rate of 95 and blood pressure of 158/88. What caused Blake's vital sign changes? Option A. Blake had a panic attack. Option B. Metoprolol withdrawal caused rebound tachycardia and hypertension. Option C. Blake has a urinary tract infection. Option D. Blake received 4 fluids overnight. The correct answer is option B. Metoprolol withdrawal caused rebound tachycardia and hypertension. Abrupt beta blocker withdrawal causes rebound sympathetic activation. Heart rate increases. Blood pressure increases. Myocardial oxygen demand increases. This can trigger heart attack or death. The night nurse made a common error. Blake's heart rate of 50 is therapeutic for heart failure. The morning nurse restarts metoprolol. Blake stabilizes. Beta blockers should never be held for mild bradycardia in asymptomatic patients with heart failure. Question 8. Alan is 64 years old. He has heart failure with reduced ejection fraction and takes lisinopril, metoprolol succinate, and furosemide. He presents with a potassium of 5.8. He has no EKG changes. Which medication is most likely causing his hyperkalemia? Option A. Metoprolol succinate. Option B. Furosemide. Option C. Lisinopril. Option D. All of the above. The correct answer is option C. Lisinopril. Lisinopril is an ACE inhibitor that reduces aldosterone secretion, leading to potassium retention. Metoprolol does not affect potassium. Furosemide causes potassium wasting, not retention. The nurse who blames the wrong medication may stop the wrong drug. Lisinopril is the culprit. The dose should be reduced or the drug changed. Question 9. Beatrice is 52 years old. She has hypertension and takes hydrochlorothiazide 25 mg daily. She presents with a new rash on her face and chest that worsens with sun exposure. She also reports joint pain and fatigue. What is the most likely cause? Option A. Hydrochlorothiazide caused drug-induced lupus. Option B. Beatrice has systemic lupus erythematosus. Option C. Beatrice has rosacea. Option D. Beatrice has an allergic reaction. The correct answer is option A. Hydrochlorothiazide caused drug-induced lupus. Hydrochlorothiazide is a known cause of drug-induced lupus erythematosus. Symptoms include rash, photosensitivity, arthralgias, and fatigue. The condition resolves when the drug is stopped. The nurse who fails to recognize this side effect may order unnecessary autoimmune testing. Beatrice needs to stop hydrochlorothiazide and switch to a different antihypertensive. Question 10. Calvin is 71 years old. He has atrial fibrillation and takes apazaban or Eliquis 5 mg twice daily. He is scheduled for a transesophageal echocardiogram or T before cardioversion. The cardiologist wants to stop apazaban for 48 hours before the procedure. What is the best response? Option A, stop apazaban as ordered. Option B, continue apazaban because T has low bleeding risk. Option C, stop apazaban for 24 hours only. Option D, stop apazaban for 72 hours. The correct answer is option B, continue apazaban because T has low bleeding risk. A T is a low bleeding risk procedure. Most guidelines recommend continuing direct oral anticoagulants around the time of T. Stopping apazaban for 48 hours increases stroke risk unnecessarily. The nurse should clarify with the cardiologist. The patient can continue apazaban. The T can be performed safely. Question 11. Deborah is 48 years old. She has no medical problems. She presents for a routine physical. Her blood pressure is 148/90 on 2 separate visits. Her BMI is 31. She drinks 2 beers daily. She smokes 1 pack daily. She does not exercise. What is the most appropriate first step? Option A, start lisinopril 10 mg daily. Option B, recommend lifestyle modifications for 3 to 6 months. Option C, start hydrochlorothiazide 12.5 mg daily. Option D, start amlodipine 5 mg daily. The correct answer is option B, recommend lifestyle modifications for 3 to 6 months. Deborah has stage 1 hypertension with multiple modifiable risk factors. Lifestyle modifications including weight loss, reduced alcohol, smoking cessation, and increased exercise are first line. She may avoid lifelong medication if she makes changes now. The nurse who starts medication without counseling misses an opportunity. Deborah needs education and support first. Question 12. Edward is 77 years old. He has heart failure with preserved ejection fraction and takes furosemide 40 mg daily. He presents with sudden onset of hearing loss and tinnitus. His furosemide dose was increased from 20 to 40 mg last week. He has no ear pain. What is the most likely cause? Option A, age-related hearing loss. Option B, furosemide-caused ototoxicity. Option C, Meniere disease. Option D, cerumen impaction. The correct answer is option B, furosemide-caused ototoxicity. Loop diuretics cause dose-dependent ototoxicity. Edward's symptoms started after a dose increase. The hearing loss may be reversible if furosemide is reduced or stopped. He needs an audiogram and a different diuretic. The nurse who dismisses this as age-related misses a preventable side effect. Edward's hearing may recover if the medication is adjusted promptly. Question 13. Frances is 62 years old. She has hypertension and takes lisinopril 20 mg daily. She develops a dry cough that has persisted for 2 months. She has tried over-the-counter cough suppressants with no relief. Her chest X-ray is normal. What is the best action? Option A, continue lisinopril and add a steroid inhaler. Option B, stop lisinopril and switch to losartan. Option C, stop lisinopril and switch to amlodipine. Option D, stop lisinopril and switch to hydrochlorothiazide. The correct answer is option B, stop lisinopril and switch to losartan. Lisinopril-induced cough is caused by bradykinin accumulation. The cough resolves after stopping the ACE inhibitor. Losartan is an ARB that provides similar cardiovascular benefits without causing cough. Switching to losartan preserves RAAS blockade. The nurse who treats the cough instead of the cause keeps Frances suffering. Her cough is the medication, not a mystery. Question 14. George is 55 years old. He has coronary artery disease and takes clopidogrel or Plavix 75 mg daily. He had a drug-eluting stent placed 4 months ago. He needs a tooth extraction. The dentist wants to stop clopidogrel for 5 days before the extraction. What is the best action? Option A, stop clopidogrel as ordered. Option B, continue clopidogrel because the extraction can be done with local hemostatic measures. Option C, stop clopidogrel for 2 days only. Option D, switch clopidogrel to aspirin alone. The correct answer is option B, continue clopidogrel because the extraction can be done with local hemostatic measures. George is within 12 months of his drug-eluting stent. Stopping clopidogrel carries a high risk of stent thrombosis with a 40% death rate. The dental extraction can be done while continuing clopidogrel using local measures. The dentist is unaware of the stent. The nurse must advocate for George. His heart is more important than his tooth. Question 15. Helen is 68 years old. She has atrial fibrillation and takes rivaroxaban or Xarelto 20 mg daily. She falls on the sidewalk and hits her head. She has a 2 cm scalp laceration. She is alert and oriented. Her neurological exam is normal. The emergency physician wants to discharge her after suturing her scalp. What should the nurse do? Option A. Discharge Helen as ordered. Option B. Insist on a head CT before discharge. Option C. Give Helen a head injury instruction sheet and send her home. Option D. Call Helen's daughter to pick her up. The correct answer is option B. Insist on a head CT before discharge. Helen is on a direct oral anticoagulant. She hit her head. Intracranial bleeding can occur without early symptoms. A head CT is mandatory regardless of her normal exam. The physician is wrong. The nurse must advocate for the CT. Helen's life depends on it. No CT means sending her home with a potentially fatal brain bleed. Question 16. Irene is 43 years old. She is 30 weeks pregnant. She has chronic hypertension and takes labetalol 200 mg twice daily. She presents with a blood pressure of 182/112, headache, and visual changes. She has proteinuria. She is diagnosed with preeclampsia with severe features. The provider orders 4-hydralazine. Irene asks why she cannot just take more labetalol by mouth. What is the best response? Option A. Oral labetalol works too slowly for severe hypertension. Option B. 4-hydralazine lowers blood pressure within minutes to prevent stroke. Option C. High-dose labetalol can cause fetal bradycardia. Option D. All of the above. The correct answer is option D. All of the above. Irene has severe hypertension in pregnancy requiring rapid treatment to prevent maternal stroke. Oral labetalol takes hours to peak. 4-hydralazine works within minutes. High-dose labetalol can cause fetal bradycardia. The nurse explains that Irene needs hospital admission for medications and close monitoring. Her life and her baby's life depend on rapid blood pressure control. Question 17. Jerome is 58 years old. He has hypertension and takes lisinopril 10 mg daily. He also takes over-the-counter potassium supplements. He presents with weakness and palpitations. His potassium is 6.8. His EKG shows peaked T waves. What is the priority intervention? Option A. Stop lisinopril only. Option B. Stop potassium supplements only. Option C. Give 4 calcium gluconate immediately. Option D. Give 4 insulin and dextrose. The correct answer is option C. Give 4 calcium gluconate immediately. Jerome has severe hyperkalemia with cardiac toxicity. Peak T waves indicate the heart is at risk. For calcium gluconate stabilizes the myocardium immediately. Both lisinopril and potassium supplements must be stopped. The nurse who delays calcium to stop medications or give insulin first puts Jerome at risk. Calcium first, then insulin and dextrose, then stop the offending agents. Question 18. Kevin is 66 years old. He has heart failure with reduced ejection fraction and takes Carvedilol 25 mg twice daily. He presents with dizziness when standing. His lying blood pressure is 128/74. His standing blood pressure is 80/42. His heart rate is 64. What is the most likely cause? Option A. Carvedilol caused orthostatic hypotension. Option B. Kevin is dehydrated. Option C. Kevin has autonomic dysfunction. Option D. Kevin has adrenal insufficiency. The correct answer is option A. Carvedilol caused orthostatic hypotension. Carvedilol is a non-selective beta blocker with alpha blocking activity. The alpha blockade causes vasodilation and orthostatic hypotension. This is a known side effect. Kevin may need a lower dose or a switch to metoprolol, which has no alpha blocking effects. The nurse who checks lying and standing blood pressure identifies the problem. Kevin does not need 4 fluids. He needs a medication adjustment.